This is National Diabetes Awareness Month, and one of the most serious problems these patients face, foot wounds that do not heal and can lead to amputation. But here to help now with some advice, podiatrist Lisa Kleemeyer and pedorthist Mark McCauslin, who is from Foot Solutions. Thank you both so much for coming in. Appreciate it. Lady. Lisa, I know you're a podiatrist. Tell me about the kinds of problems diabetics face and why.
The biggest reason diabetics are at higher risk for foot problems is lack of circulation, problems with their circulation, and problem with their sensation or peripheral neuropathy. They can develop small wounds that might become bigger problems and serious infections.
And this is when we often hear about wounds that just do not heal, right? And they don't heal because of the blood flow, or what is it?
Blood flow and diabetes also can affect your immune system, your ability to fight infection and heal a wound the way normal or non-diabetic patient might. But mostly circulation too also.
All right, and I know you refer a lot of your patients to a kind of a health expert called a pedorthist, and Mark, you work at Foot Solutions. What do you do there?
What I do is we evaluate feet in regards to Dr. Kleemeyer will send people in basically looking for an extra depth shoe for a diabetic so that they don't get any type of rubbing that can create irritation that can develop into ulcers. One of the things we also do is we take time measuring feet. Most people wear shoes too small, which on a diabetic, especially because they can't feel anything, do create a lot of the problems what Dr. Kleemeyer was talking about in regards to injuries and wounds.
Right, and what kind of a difference do you see that make?
Well, what we're trying to do is we're trying to prevent all this. So, I mean, that's really, we're trying to do something preventative instead of getting into where she specializes with wound care, amputations, and that. So that's one of the benefits with the diabetic foot bill in regards to how diabetic can get shoes through Medicare, where Medicare will pay 80%, that will allow them to get proper shoes to basically prevent a lot of these amputations.
And I know even socks make a difference. Tell us about that.
Well, with socks, we go to socks that are, one, going to give them cushioning, wick away moisture, as well as being seamless. Again, with a diabetic foot, they might not feel a little bit of a thread or a nylon knot that can irritate the foot.
And that can lead to some serious problems. Lisa, what kind of a difference do you see with your patients then after they have the right shoes, after they have the right socks?
Well, it really comes down to prevention. You know, we'd like to ultimately see people not develop the wounds in the first place. For me, it's just a comfort level of, since I can't go shopping with my patients, to have a place to be able to send them and know they're going to get the right products, the products they need to prevent these problems.
And it actually helps? Just shoes and socks?
Just shoes and socks. It seems maybe too simple to be true, but it's almost the common sense kind of things that are going to really help these patients down the line, even just as much as inspecting their own feet every day. Once they take their shoe or their sock off, they're going to be their own best preventative measure to catch things early.
Okay, and Mark, you're also going to be doing some screenings. Tell us about that.
Yeah, what we do is we take evaluations of their feet in regards to arch definition, pressure points. A lot of times, again, with a diabetic foot, they might have a lot of areas that are susceptible to getting callousing in pre-ulcer situations. So different things we can do to a diabetic insert to make them more comfortable and to alleviate some of that pressure so that they don't develop something that can become an ulcer.
Something as simple as shoes and socks can really mean the difference between amputation or not. Okay, Mark McCauslin and Dr. Lisa Kleemeyer, thank you so very much for coming in. And if you'd like more information, go to mysuncoast.com and click on Health Smart. And we'll be right back.